Hi, my name is Beth Shook and I'm your nurse educator. Today I'd like to talk to you about transgender pharmacotherapy. Trans men, trans women, non-binary, and all other people on the trans spectrum have to consider whether or not they want to take medication as part of transitioning from one sexual gender to the opposite gender. There are several medications that can be used within the trans community to replace the body's natural hormones, to suppress hormones, and to provide other hormones that help alleviate the side effects of hormonal replacements. Choosing to take medication as part of transitioning from male to female, MTF is how it'll be abbreviated in this presentation, is part of the feminizing medications. Estrogen, conjugated equine oestrogen, ethinyl estradiol. Estrogen is the most common drug used in sexual transitioning from male to female, and it comes in pill form, a patch, which is better for people over age 40, smokers, and anyone that has circulatory problems, and then there's the gel delivery method. The gel delivery method is not safe for use if you are skin-to-skin contact with children, as the exposure can cause children to develop large genitalia, grow pubic hair, and grow breast early. The conjugated equine oestrogen is taken from mare's urine and put into a pill delivery method. This method has seemed unethical, so it's not commonly used and has a higher risk of side effects than estrogen. Ethinyl estradiol is the least common feminizing hormone. It's taken in a pill form and has the highest risk for side effects of all the feminizing hormones that are available on the market. In male to female transitioning, estrogen is a common hormonal therapy, and it's used during sexual transition to better align your physical appearance with your gender identity. Estrogens aid the development of breast, redistribute body and facial fat, and reduce body or facial hair. This therapy is relatively safe without significant risk of adverse side effects. However, prolactin levels must be monitored due to evidence-based research showing estrogen therapy has caused prolactin-secreting tumors later in life. Choosing to take medication as part of transitioning from female to male, FTM, includes masculinizing medications, also known as androgens. They include testosterone, finasteride, goserelin, and leuprorelin. Testosterone belongs to a class of male hormones called androgens, which are sometimes also called steroids or anabolic steroids. In men, testosterone is produced mainly in the testes, with a small amount made in the adrenal glands. The brain's hypothalamus and pituitary gland control testosterone production. The hypothalamus instructs the pituitary gland on how much testosterone to produce, and the pituitary gland passes this message on to the testes. These communications happen through chemicals and hormones in the bloodstream. Testosterone is the standard treatment to promote male characteristics in a person that is born with a female body but identifies as a male. Testosterone does promote hair growth, deepening voice, breast tissue atrophy, and cessation of menses. Testosterone is a hormone that is administered by IM, sub-Q, patches, gels, buccal, and tablets. One of the side effects of testosterone is hair loss. Finasteride is taken in a pill form, and it works by reducing the effects of testosterone, and it promotes hair regrowth on hair on a head that if the hair follicles have not been inactive too long. Goserelin and leuprorelin are administered sub-Q and have few side effects in reducing the effects of estrogen. Many times these medications are prescribed to adolescents that are considering sexual transitioning to stop puberty so that they can decide later in their life if they want to take testosterone or estrogen. Sexual transitioning is mainly happens from male to female when estrogen is increased and testosterone decreased. When transitioning from female to male, testosterone is increased with estrogen being decreased. Some of the things that people need to consider when they're considering hormonal therapy is do not buy or use medication that you've obtained from an unknown source. Find medical providers that specialize in sexual transitioning for proper care management and hormone regimen. Seek counseling for opportunities to examine your decision and coping with the changes that will happen in your life. Also, consider that internet sales, many times they offer, black market sites offer kits for transitioning. They are not FDA approved and they are not probably what they claim to be. Also, consider when you look for a medical provider, one that is specialized in the field of transitioning in order to, so that you can have safe care while transitioning. I wanted to include one resource. It's the Safe Zone Project, and I've included the website address. If you get a chance, look at this project. It's really a great opportunity for educators to provide opportunities to lesbian, gay, bisexual, and transgender youth. As a school nurse, I have seen youth struggle with the decision of their gender identity. So this research project has given me an opportunity to be able to provide education to them in making decisions about sexual gender transitioning, and I thank you for that. If you have any questions, please post them on the discussion board and I will answer them promptly. Thank you.